Alright, let's talk about interferons, or IFN. So interferon is a kind of cytokines. So what are cytokines? Cytokines are basically substances or proteins that are produced by our immune system, and depending on which one we are talking about, they will have different function in our immune system. So the main ones that you're going to be learning in this unit will be your interferons and interleukins. So interferons, mainly their purpose is antiviral, so they help fight viral illnesses. While interleukins, it has an inflammatory and as well as anti-inflammatory effect. So it influences inflammation, and at the same time it helps reduce inflammation, so depending on which one we are talking about. So going back to interferons, so interferons are basically proteins, right? They're a form of cytokines. So in this specific case, they are genetically modified or engineered DNA. So these are very identical to our naturally occurring interferon cytokines. So again, their main effect, just like our endogenous interferons or IFN, they're mainly for viral illnesses, but they are also used as anti-tumor, and it also improves immune response to cancer cells. So again, these are mainly used for viral illnesses, for tumor, and it improves immune response to cancer cells. So there are different groups. We have the alpha, beta, and gamma. So basically, they are, depending on which group they belong to, they have a very specific function or biologic activity that they affect. But again, mainly they're used for viral infection and certain types of cancers. So the uses, so there's 3 different effects of interference. So specific action is depending on the drug that we're talking about. 1, they help restore the impaired function of the immune system. 2, it augments, amplifies, or basically make the immune system's defenses stronger. And lastly, they inhibit immune system activity from working. So this is very useful when the immune system has become dysfunctional, causing an autoimmune disease. So main functions, they can be antiviral and anti-neoplastic or anti-tumor. So for antiviral, they enable cells to produce enzymes that stops viral production and penetration of healthy cells. While as an anti-neoplastic or anti-tumor, so basically when we're using it for cancer, it prevents the cancer cell division and replication, thus inhibiting the DNA in cancer cells. So it prevents the cancer from growing, the cancer cells from multiplying, right, or getting bigger. So some patient education, we have to educate them that these drugs can cause fatigue and they will feel like they have the flu because of their role in the immune response or immune system. This is protein bound, and this goes through the P450 metabolism. So this is basically metabolized by the liver. Now, we won't really educate our patients that, it goes through CYP450 and all that, right? Because they're not going to understand that. But the very important piece that we have to tell them about is that this may interact with the other drugs or even supplements that they're taking. Therefore, it is very important for them to give us a very detailed and accurate history of all the medications that they are taking. That way we need to make sure that there's no interactions. So examples of drugs under this class, we have the interferon alpha 2A, interferon beta 1B, and interferon gamma 1B. The interferon beta 1B, this is indicated for treatment of relapsing of multiple sclerosis. So this slows down the progression of the physical disability, and it decreases the frequency of exacerbations or acute attacks of multiple sclerosis. Monoclonal antibodies, so these are basically produced by recombinant DNA. So this is genetically engineered to stimulate endogenous monoclonal antibodies activity. So depending on which one we're talking about, it stimulates specific cells, and the activity is dependent on the drug that we're talking about. So they will have different functions. The main uses or advantages of these drugs, so pay attention to this, make sure that you highlight it. The uses of these drugs include the targeting specific cancer cells with minimal effect on normal cells. So as you guys are probably familiar with chemotherapy, chemotherapy usually does not differentiate between the normal and abnormal cells. So sometimes it will kill off normal cells. These medications or this class of medications, on the other hand, is able to differentiate the normal cells from abnormal cells a little better. Therefore, there's very small or little effect on the normal cells. So it's still going can affect it, but not as much. And so in addition, this is also used specifically for autoimmune diseases such as psoriasis and ulcerative colitis. So patient education, we need to educate our patient regarding possible severe allergic reactions. And then again, just like the other medication that we were talking about, the interferons, this can also cause flu-like symptoms as well as GI distress. Some specific side effects based on which medication we are talking about. So the bevacizumab, it can cause delayed wound healing due to the drug action. The trastuzumab can cause ventricular dysfunction, heart failure, and fatal hypersensitivity. So it has a black box warning. Again, for this specific drug, trastuzumab can cause ventricular dysfunction, heart failure, and fatal hypersensitivity reaction. And then lastly, adalimumab is contraindicated with any active infection. So again, this affects your immune system, right? And so if you know that a patient has an active infection, this medication is actually contraindicated. An example of this is my brother-in-law. So he takes this Humira or adalimumab. He takes this medication for psoriasis because he developed valley fever. He had to be off the medication because it's contraindicated, because then he will have a hard time fighting that infection if he continues to be on this medication. Anyhow, well, in addition to being used for psoriasis, this specific medication, Humira or adalimumab, is actually also used for rheumatoid arthritis. So as you can see, they're autoimmune diseases. So the examples of drugs that you have to remember under this class, so if you look at the suffixes, right, the pattern, it ends in MAB. So it stands for monoclonal antibodies. So the first one that you have to remember is the bevacizumab, and then second is the trastuzumab, and then the adalimumab. All right, next we're going to talk about interleukins or IL. So interleukins, as mentioned earlier, it's another type of cytokine, and this specific drug is from recombinant DNA, so it's genetically engineered to have the same function or have the same activity as the endogenous or our naturally occurring interleukin. So naturally, our endogenous interleukins origin is from activated lymphocytes. So interleukins are released from activated lymphocytes. So that's our natural or endogenous interleukins. So their main function is to recognize and kill only cancer cells. So you see the difference between the monoclonal antibodies and interleukins is that monoclonal antibodies, they still have minimal effect on the normal cells, right? So it doesn't completely recognize all of them as normal cells, so it still affects those. But for interleukins, it recognizes and kills only just the cancer cells or abnormal cells. The main uses of this drug are basically specific depending on the drug that we're talking about. And as mentioned earlier just now, it is for cancer. So type of cancer that we use interleukins for include renal cell cancer, rheumatoid arthritis, and metastatic melanoma. So patient education. So especially for this drug, well, all our drugs, right? But especially for this drug, it is very important to educate our patients for these possible side effects. So one of the side effects that we have to educate our patients about is the capillary leak syndrome. So capillary leak syndrome is basically induced by the interleukin therapy. So what happens is that because of the changes in protein, especially albumin, the capillaries become leaky, and so it causes inflammation or swelling, so fluid shifting from a space to another space where they're not supposed to be. The capillaries lose the ability to retain the vital colloids such as albumin, protein, and other essential components of the blood. Because of that, right, because of the shifting of fluids, it can cause severe hypotension or low blood pressure, and again, it affects your albumin, so it decreases albumin levels, so hypoalbuminemia, and it also decreases the plasma volume. It causes hemoconcentration. An important piece of patient education for these patients who are receiving interleukins is to monitor their weight. If there's a sudden increase or decrease, it's something that they need to be reporting to their provider or to us nurses. In addition, this is generally contraindicated with cardiopulmonary dysfunction and organ transplant. And again, the reason being is that the fluids are shifting, and because of this possible side effect, right, it can cause severe shifting of fluid. It can actually worsen the different conditions such as CHF or congestive heart failure, or even somebody who has a history of of renal failure and had a history of transplant, it can cause problems with that or complications. The drug that you have to remember under this class is aldesleukin. So as you can see the suffix, it says leukin over here. So this is an easy way to remember that this drug belongs to the drug class interleukins. So aldesleukin, its specific function is basically stimulating and restoring the immune response. So it activates T cells or T lymphocytes.